Probably one of the most deeply felt concerns on the part of many people is how are we going to get out of this situation, and what do we do in response to the circumstances we find ourselves in. I thought these reflections that I'm offering during this period of difficulty in our world would help to reflect through the lens of the mission of the Acton Institute. Most recently, at least here in the United States, the government has acted quite dramatically. There's now a $2 trillion bailout that's being offered. And people are thinking to themselves, as I am thinking to myself, what is going to be the result of this? Now, you add this $2 trillion to the other deficit, and somebody estimated that it's almost a debt of something in the area of $70,000 per person, man, woman, and child. And debt is a weight. All of that money that we commit ourselves to in debt are things that we have to carry around with ourselves. And when an entire society goes into the levels of debt that we're talking about, unprecedented, it's very difficult to understand what the impact is going to be and how we're going to get out of this situation. So the first thing I want to underscore is something that I've underscored in a number of these discussions previously, that it is a shame yet again to see that the response comes in the form of growing government. I understand that there are certain interventions in an emergency situation that need to be taken by the government. But when the thought of just adding to the deficit for things that have nothing to do with the pandemic, if I haven't gone through the budget in great detail, but I have read enough to know that there are things in this $2 trillion, just the $2 trillion part of it, that are irrelevant to the direct thing that is the crisis, that gives the justification for intervention. And then, of course, the deeper problem is, how do we get out of it? How do we get out of it in terms of the debt, but also in terms of the ratcheting up of the involvement and the intervention of the government in various parts of our lives? And I think one of the questions we need to ask ourselves is, how tolerant are we becoming to these interventions? The greatest danger here is that we acclimate ourselves to this notion that the government is the resource of first resort rather than the resource of last resort. That this disease occurs in the bodies of human beings, and that this disease is very individual in one sense and very local. If the response then is from a central planning constantly, I think we miss the real issue that's going on. So from my vantage point, inverting that set of priority, allowing the most local level of people to involve themselves because they know what the concrete needs are. And this also applies to the remedy of the solution. Once we have sufficient testing, which is probably one of the most important things at this stage of the contagion, to test to see what's really going on, because the fear, as I mentioned previously, is the fear of not knowing. To know what's going on will enable us to understand how to combat this, so that if in a given locality, in a given city, even in a given neighborhood or a given organization, there is a great deal of infection, then what we can do is, in those circumstances, have people locked down, have people prevent the contagion. But to take the approach that the federal government knows what's happening in any given neighborhood, in any given city, is an absurdity. And I think not just an absurdity, but also a great danger. So again, this notion of subsidiarity that I've mentioned previously, that we've studied in great detail, is and tells us once again that needs are best met at the level where people know each other. They know the needs that exist. So these are just some thoughts for you in this time of meditation and contemplation. We pray that your families are well and that you're staying safe. God bless.